The reason why root canals are so bad is when they take the nerve out of the tooth is dead, and the dentists are the only doctors that'll leave a dead part, the dead bone in your body. And what happens is bacteria is still in that tooth, and they're producing toxins, and that toxin gets into your bloodstream. I just had my root canal tooth pulled last week, and I felt great as soon as it came out. All these women with breast cancer, 98% of them had root canals.
Oh,
there was only
Stop it.
No,
Stop it. Hold on. Just stop. Stop.
That's what the documentary says.
What if I could tell you that 98% of women that have breast cancer have a root canal tooth on the same side as their breast cancer?
I would love to see that actually backed up.
Rover, I've got the doctor from the documentary that we just played there on the phone here.
Dr. Dawn, good morning. How are you?
Hello, I'm doing fine, thank you.
All right. Now, are you the one in this documentary, Root Cause, that says that 98% of people who have breast cancer had a root canal on the same side? Was that you or was that someone else?
Well, that was several of us. It was slightly taken out of context, but Dr. Rao's research in his clinic showed that 98% of the women in his clinic that had breast cancer had a root canal on the tooth related to the same breast on that same side.
Uh-huh. And this was one guy's sort of, just one guy, so not like a mass study or anything.
No, it's not a mass study, but those of us that do this kind of work, we find very similar findings. And it's not just breast cancer. My research for my thesis originally was a lot of men that had elevated PSAs had root canals or a tooth that had been knocked out and had a dead area in the jaw on the same teeth that were related to the prostate.
Because we can't find any research that backs up this 98% of patients with breast cancer had a root canal on the same side as the cancer. We can't find any studies that back that up. I would think that would be something that would be researched. But
yes.
So it's
again, if you look at Dr. Rao, it's Dr. R-A-U, and if you Google him and breast cancer, you'll probably come up with that research.
Okay. So I will look that up. Now, what would the scientific explanation be that if I have a root canal on the right side of my mouth, I would get breast cancer on the right side of my body? That doesn't seem to make any sort of sense to me biologically. Our circulatory system is all over. It's, so it's not just, it's not divided on the right side of my body and the left. So what's the explanation for that?
Because you have energetic pathways called meridians. Just like when you have a stroke, it affects the opposite side of your body.
Well, hold on 1 second. Hold on.
Mm-hmm.
So a stroke is not, it doesn't affect the opposite side of my body because of a meridian. This is like acupuncture stuff is the meridian.
It is acupuncture stuff. If you let me finish, then I would say a meridian stays on its side. And so
but meridians haven't actually, wait a second, meridians, this is like ancient Chinese medicine, not Western scientific medicine. Hold on. These energy pathways, as you're describing them, are not actually, they just don't exist. I mean, this is not a real thing.
That's not true. That's not true. They've been proven if you inject a radioisotope into an acupuncture point and you start taking imaging, you will see the imaging go up the meridian, not a nerve, not an artery, not any kind of blood vessel. It goes up.
So what is it? What is the meridian? Is it something that when I am dissected, they could actually find the meridian? Why haven't we found that? Why hasn't that been dissected?
Because it's an energetic pathway.
That's nonsense. That's like crystals. That's like healing crystals.
Are you serious?
Yes, I'm dead serious.
Try doing an EKG on a corpse. You can't. Why? Because there's no freaking electricity.
Now, let me just, I guess, what is your background? You're a doctor of what?
I'm a doctor of integrative medicine. I'm the executive director of the International Academy of Biological Dentistry and Medicine.
What is
Those
a
are
doctor of
dentists that
integrated medicine? What does that mean exactly?
that we look at everything from your diet to your blood work to your teeth. And then usually we will make a referral to an appropriate person for you to get help. Because a lot of people come in with health problems, and it's actually a dental issue.
So you're telling me Meridians are a scientifically accepted in mainstream medicine?
Absolutely. Without a doubt.
Yeah, I got to dispute that, but okay. So that's why the breast cancer supposedly stays on the same side.
Yeah, it's not just breast cancer. I wish you'd not just focus on that.
But that's the explosive claim. I mean, that's the claim in the documentary. 98% of breast cancer patients have breast cancer on the same side that they had root canals on the same side. No study backs that up.
If you have a prostate or kidney problem, you'll find that tooth is usually going to be on the same side as the kidney that is affected. You'll find that if the person has...
According to what studies? According to where can I look up this research and see that if I have a kidney problem, I have a root canal tooth on that same side of my body? Where can you show me like peer-reviewed studies where I can see that?
If you go to any of Dr. Voll's work, there are white papers.
So one guy.
Dr. Reinhard Voll. No, but that's the most research that's out there.
And what was his methodology? So one guy. I mean, I would see. So the American Dental Association or whatever, they agree with this hypothesis.
No, it's not a hypothesis.
No, but so they agree. This is so well researched and peer reviewed that the ADA has said yes, this is a real thing.
No, the ADA is behind. The ADA still thinks mercury fillings are okay.
The UCLA School of Dentistry, they've probably researched this and have come to the same conclusion, correct?
No, they haven't, but they're also not looking at mercury toxicity. They're not looking at stem cell research.
Okay, but they're just saying that everything in this documentary is pretty much BS. I mean, they're refuting literally everything that's said in this documentary. I'm just wondering why these major groups are not backing up this supposedly peer research review. Now you've thrown out a guy's wait, hold on. You've thrown out a guy's name, and I think that's probably disingenuous. I think that's probably one guy who did a very, if he was any sort of study at all, I would be surprised. But it's not. I guarantee it's not peer reviewed. It hasn't been duplicated.
How can you guarantee something when you have no information about it?
Because I know the kinds of kooky things that are said.
Particular tooth, have that tooth removed and then them go into remission. How do you explain that? God put this body together and you can't explain everything. You can't explain the energy of how things happen. I mean, you're showing your ignorance in saying that people that come in that get treatment for something that is so bizarre to you that they're having no health benefits from it. Do you realize how ignorant you sound?
But so the UCLA, the School of Dentistry, they are ignorant then. I just want to, so no, I'm not a dentist. So hold on. This School of Dentistry at UCLA, an esteemed university, who says this is junk science. Hold on. Hold on, Dawn. UCLA, you're telling me that UCLA School of Dentistry is ignorant and they don't know what they're talking about. That's what you're telling me. Yeah. Because they say this is junk science.
I don't care what they say. They're not in the field.
They're not in the field of dentistry? It's the UCLA School of Dentistry.
No, they are not in practice. They are educators, not practitioners. When practitioners get out and they start seeing the truth for themselves, it becomes a reality.
Mm-hmm. Okay.
Again, all the dental schools still teach placing amalgam. There are other countries that refuse to put mercury fillings in people's mouths. And yet the dental schools, in their ignorance, still teach that.
Okay, so the study that you wanted, Dr. Reinhard Volt, is that what you want me to look up?
Vol, Dr. Reinhard Vol, V-O-L-L.
Okay, all
You
right.
could look up William Tiller. You can look at Holistic Dental Matrix, Tooth Truth.
Hold on. Now, in the 1940s, so we're going back to this Reinhard Vol in 1940s? A German doctor? Wait, hold on. Wait, stop the presses. So,
the times the dental schools are.
so by this time, hold on. Dawn. Okay. So you're telling me the supposed proof that you're offering me on this is one guy, one German, I would assume Nazi.
One German guy with 100 doctors doing this.
One German study from the 1940s. So you would think by now, it's 2019, you would think by now that one study would have been duplicated, replicated, confirmed countless times, correct?
Do your homework and you'll find
But it hasn't. It hasn't. It hasn't.
You're showing your ignorance.
But
You're showing
so
your
if it's been
ignorance because you've not
duplicated
done
and
your
it's such
homework.
well-accepted standard, why are all of these places saying it's junk science and you're a kook? You're a kook.
I just gave you the information to find one of the references. And in your ignorance, you've not done your homework to even find that one until I gave it to you.
I just found it, and it's from 1940 Germany. So you should be able. Hold on, stop. Okay,
this information.
I'm taking. All right, so this Dr. Reinhard Vol study from 1940. I have a pen ready. Give me all of the credible, peer-reviewed academic studies proving the same thing as that one from 1940. I got a pen ready. I'm ready to make a list. Number one is what?
I am sitting in my car waiting to see patients, and you're asking me for references.
Well, you said I was ignorant and you could provide this, so I'm asking you just
ignorant, sir.
give me.
Look at Weston Price. Look at William Tiller's work.
Weston. No. So they're going to say exactly the same thing as this Vol guy.
You're going to get a whole bunch of information that will enlighten your ignorance.
Okay, so for instance, Dr. Weston Price.
They told me this would be a 5-minute phone call.
This was in the This was in the 1930s. You're giving me a study. You were actually going back in time, so we could probably go back to the Dark Ages. Dr. Weston Price was in the 1930s. I'm talking about since these studies, recent peer-reviewed scientific studies that back all of this hocus pocus up. Give me some of them.
Do you believe in God? Do you believe in prayer?
No. Because
that makes total sense.
Dawn, do you pray?
Again,
these mass shootings that we just had in Dayton and El Paso. Did you pray for those cities?
I did pray for them.
Okay. Did you pray for the other cities where these mass shootings occurred?
Absolutely.
Why are they still happening? All of the thoughts and prayers, they haven't healed the problem yet. They haven't solved the problem. I mean, if you talk about science and studies that are hocus pocus, you would think all of your thoughts and prayers would have stopped the scourge of mass shootings by now. So, no, I don't believe in that nonsense.
A dark individual. I'm sad for you, and I will pray for you.
Oh,
I was going to pray for you.
Thank you. All right. Dr. Dawn, thank you. What a freaking loon.